Alexis Moore.
I'm Alex Moore.
I'm Laura Meissner.
Melissa Mischler.
Ryan Mischler.
Hi, I'm Misty Mischler, and this is going to be my informative speech on PTSD. PTSD, or post-traumatic stress disorder. Many of us don't really know what it is or what it really means. How many of you really know what it means? I know 2 of you do because you have it, which is great. Not great that you have it, but great that I can talk to you about it. It's a common term that we hear, but how is it triggered? How do people have it? How do they get it? Things like that. We're going to go over a little bit about that. We're going to learn about their visual stimulations, smells, colors, different things like that. And we have to understand that that's not the only thing that triggers them. There are internal triggers, external triggers, smells, sights, visual things like seeing a car accident, hearing a noise, but they're not the only ones that are affected. It can also affect their family members, co-workers, loved ones, and their kids. So what we're going to do is we're going to do a little bit of the statistics on the triggers, and we'll conclude with the kids and treatment. American Statistics stats from Sheila Sardane-Giller, her website for PTSD survivors, states that 70% of adults have experienced traumatic events, and 20% of those move on to develop PTSD. And that said that 5% of Americans have had PTSD at some point in their life. And that is approximately 13 million people have suffered from PTSD. Some of the internal triggers, based on the American Psychological Association's website in 2018, states that certain memories, feelings of abandonment, feeling out of control, pain, muscle tension, heart rate, all of these things can actually trigger PTSD, which can be outbursts of anger, anxiety, reclusiveness, things like that. External triggers can be an argument with a spouse, a certain smell that they've smelled right before the traumatic experience, certain tactile or physical things. Somebody touching them a certain way can make them have the anxiety and stuff that comes along with PTSD. One of the things that they don't know is how it affects the children of these people who have PTSD. So the survivors of PTSD have kids. How does it affect them? There's usually 3 types of children. One is the over-identifiers. So they try to be like mom or dad or whoever their loved one is. When mom gets angry, they get angry. They identify with them. The other one is a rescuer, where they go to their loved one and they're like, it's okay, I'm going to take care of you. And then there's the emotionally uninvolved, where the child's just like, whatever, this has nothing to do with me, and they are emotionally uninvolved with the situation. The best thing to do with the kids is listen to them, listen to what they're saying, what they're hearing, talk to them about your symptoms. Make sure they understand it's not their fault. Let them know about their symptoms. Of course, don't give them too many details, especially with people that are, have been raped or in a war. You don't want to give them those details. And then there are other things that you can do for PTSD. There's treatment for PTSD. People with mild PTSD can actually take medication and get a little bit of counseling, and they'll actually go out of it and come out of it. There's also the deeper side of it, where you're going to need more medication, more treatment. Only it's going to be a lifetime thing. PTSD is not only an emotional burden, it's a physical burden, it's a financial burden to everybody involved. However, we'd like you to go away thinking that you could be more productive to that person, be more understanding, be loving and caring, compassionate, and help them work through these things. Because they don't want to act like this. They don't want to have these anger outbursts. They don't want any of that. They really want to be normal, functioning citizens. And the more we understand and the more we love them and are patient with them, then the better off everybody's life will be. Thank you.
Yeah.